I'm Dr. Robbie Goldstein. I'm an infectious disease physician at Mass General Hospital in Boston, and I ran for Congress in the 8th Congressional District of Massachusetts. The week that I launched my congressional campaign, I was working on the inpatient medical service at the hospital. I was working with the residents. They were presenting to me a new case that had come in overnight. It was an elderly man who lived in a senior facility, sort of an assisted living facility. He would have his meals delivered to him every day, Monday through Friday. At lunchtime, someone would come with 3 meals that would sustain him for the next day. And one Friday, the volunteer didn't show up with food. And this person went Friday, Saturday, Sunday, Monday morning without any food. At some point over the weekend, he was so weak that he fell to the ground. He couldn't get back up. And it wasn't until early Monday when someone went to check on him that he was able to get the help he needed. They called 911, they brought him to the hospital, and then he got admitted to my service. And his story is a story of a lack of us understanding that food security is healthcare. And if we don't provide food security for everyone in this country, we're not going to be able to make sure that everyone can be healthy. These are real conversations that I'm having all the time with patients. And those are the stories that should be driving the policy that comes out of Washington.
Without objection, the gentleman from Georgia is recognized.
Any primary care doctor, any doctor that does sit one-on-one in an exam room with patients, it's impossible for anyone in that position to say healthcare is not a human right. You must make sure that we provide health insurance to everyone, that we unlink that from employment. So many of my patients have lost their job over the past 9 months, and they don't have insurance because they lost their job. And I spend hours trying to figure out how to get them the insurance they need. Bringing that experience to Washington, bringing that experience to any state house across the country is going to create a better system than what we have. So I've been told that I'm not allowed to say that we lost the campaign, even though we didn't win on election night. We ran an amazing campaign, and that we just didn't get enough votes. At the end of the day, we simply ran out of time and resources to connect with as many as we needed to win. I want to go back and say I am proud of what we did, and to make that very clear, we got 54,000 votes, which is more votes than any challenger has ever received. It is more votes than the incumbent received in 2018 when he was victorious. Really early on in the campaign, my campaign manager said to me, "Do you think you really can be prepared for someone to walk up to you, ask you any question in the world and expect that you have the answer?" And I said, "What do you think it's like for a primary care doctor every day?" That is exactly what we have to do every day. All right, so I think I had some unique skills that helped me, but learning the world of politics is very, very hard. And I think I was grateful to have supporters and organizations that helped me enter this world